Welcome everybody to the closing session of the 2021 Handwashing Innovations Think Tank. Next slide, please. For all of you that you're joining for the first day with the Think Tank, then welcome to you, and also everybody who's returning from other sessions we've had the past couple of weeks, or all the sessions we've had. A sincere thank you. The way that we have a think tank is only through the good input and the good thinking that comes from all of you. So we're certainly very appreciative of all of your work that's been done during these sessions. Look forward to the work that will come out of the session today. And just a couple of reminders here in the virtual meeting. We do have the raise hand function in Zoom. Unless you're speaking, then keep yourself muted and your video off. And then we will have breakout rooms today, but we'll describe that in more detail later. And also we have the shared Google folder, which you've been sent. And so the Google folder, there's some sheets there to take notes when you're in the breakout groups. And then there's a product from the breakout groups. And we'll describe that later when we're about to go into the breakout groups. But please become familiar with that in the Google folder, the sales sheets, and then we have those slides for the results from the breakout groups when we come back into plenary. Okay, next slide. So just to recap, this is the 5th session of the think tank. 2 weeks ago, on May 7th, we had our first meeting of the 2021 think tank, and that was going over the current state of hand hygiene and how we move forward to optimize our efforts going from there. And next, we had the session on hand hygiene habits, and then inclusive hand hygiene, purposeful partnerships, and today we're looking more broadly to what's the big goal for us, the next big goal. How do we define this, and how do we move forward thinking about universal hand hygiene? Okay, and next slide. And so today's session looks familiar. We'll have the catalyst presentation. We'll have breakout groups. Then we'll come back into plenary and present your results of what you came up with on how to consider and how to measure universal hand hygiene. And then we'll just have a few minutes to go over next steps, what we're going to do with all of these thoughts that we've captured the past couple of weeks, and sharing those with outside groups, and also amplifying these think tank sessions. And next slide. And now I'd like to turn the catalyst presentation over to my partner today, Nicole, and we're so glad to have her with us and to be helping to lead today's session. So Nicole, over to you.
Thank you very much, Ron, for the introductions. Can you hear me well?
Can hear you great.
Wonderful, great. Welcome to the final session of the think tank. Unfortunately, I wasn't able to participate in the first couple of them, but I heard and I've watched the recordings. I think there was some great thinking done. Today, you're going to have a little bit of a shorter kind of introductory presentation, because we want you to do more thinking and less listening. So next slide, please. Just to introduce myself, my name is Nicole Klesner-Metzner. I work in the wash sector for the last 15, 18 years. And I am currently a WASH specialist within UNICEF Rosa, our South Asia office, supporting, amongst other things, on hand hygiene. So, sorry, next slide. So for today, we're talking a little bit about the next big goal for hand hygiene. What could this be? How do we define it? And how do we know we're there? So basically, the idea came up after thinking, how do we know once we have achieved hand hygiene for all? We've all gotten very used to using the phrase hand hygiene for all. We want to achieve hand hygiene for all. But I had lots of discussions where people were asking, what is hand hygiene for all? What do we mean with it? What are we going to do to get there? And where is there? And so for today, we're going to have a look at exactly those questions. And the basis for this was looking at other successful, large-scale WASH or not WASH-related activities and initiatives. So basically, we had a look at initiatives such as Clean Green Pakistan, the Swachh Bharat mission, the Eradicate Polio initiatives, and so on. And there are a couple of commonalities that those have. One is definitely political sponsorship. There is a clear allocation of funds. It's normally a target-driven approach. And they deal with kind of interconnected challenges. So learning from those successful national campaigns, such as Clean Green Pakistan, Swachh Bharat, we have seen the power of very simple messaging. They always have one very clear goal that was basically sellable in an elevator pitch. 30 seconds, 50 seconds. If you're asking my colleagues working in the India office, they are all able to explain to you what Swachh Bharat, a multi-billion-dollar initiative, was all about within 10 to 20 seconds. I can't do that, by the way. Next slide, please. So one of the examples that we would like to share today is the Clean Green Pakistan campaign, which is a combination of WASH activities with climate change. So the Home Ministry for Clean Green Pakistan is the Ministry of Climate Change, but the aspects that are dealt with are very much related to WASH, as you can see when you're looking into the index. So we're talking about water, we're talking about sanitation, we're talking about hygiene, then aspects of solid waste as well as plantation or reforestation come into play. They have separated the initiatives out into basically 3 different approaches. One of them recently added, over a year ago added, is the COVID response. Then the other one was the Clean Green City Index, as well as the volunteers or the champions. So this is a campaign that was thought out by politicians, that is quite comprehensive, where the idea is really to get the whole country behind it. The same is valid for the Swachh Bharat or Clean India mission, which you're probably all quite familiar with. It's a countrywide campaign initiated by the government of India in 2014, which declared India basically open defecation free in 2019. That said, in 2014, when it started, there were about 430 million people that were still officially practicing open defecation. So there was quite a large task there. The funding, to go back to those 4 points that I mentioned earlier, one of the key aspects of the Swachh Bharat mission, just like the Clean Green Pakistan mission, was really that they had designated ministries that were housing the initiative. Very clear funding, for example, for Clean India, the rural development was taken care of by the Ministry of Water and Sanitation, while urban was done via the Ministry of Housing and Urban Issues, I think it is. But in both situations, they were working with a variety of financing and funding mechanisms, and had a variety of campaigns that were going on at the same time to get buy-in across the society. So that included intensive communication campaigns, that included brand ambassadors, ranging from cricketers to Bollywood stars. Basically, you would not be able to not hear about the Swachh Bharat mission if you were living in India. It was everywhere and very well communicated, very well visible to everybody. Same as the currently ongoing Clean Green Pakistan campaign, which has been tested in one area of Pakistan so far, and is currently in the rollout of to go nationwide. Next slide, please. So another of those big ideas, or basically one of the big ideas that led to those initiatives, as I just presented them, was a big ambitious goal in itself: openification free. What is, so basically the question was, how do we get people to stop defecating in the open? You're all very, very familiar with that question, and we've all worked on the topic probably. But the interesting thing was how it started. The discussion was about how do we make sure that we're including every single aspect of programming in it. There were talks about hand hygiene. There were talks about how do we get infrastructure to people. What are the best ways of achieving openification free areas? You have a variety of methodologies, and this is transferable to hand hygiene. What we're missing still is this clear protocol. What is hand hygiene for all? We do know what we understand under openification free. What we're missing is what is hand hygiene for all. So while openification free is clearly defined, it allows us to work towards it, which is what we will try to do later, is defining hand hygiene and then allowing ourselves to work towards defining it. Next slide. Another example would be the polio eradication campaign. It's a very particular disease. We're very close to eradicating it. There is 2 countries, which are both in the region that I support, Afghanistan and Pakistan, where wild polio wasn't, the wild polio virus wasn't quite eradicated yet. But the campaign, the initiative, polio eradication, was very clear. It had a clear goal. It had a clear alliance of partners behind it that were working towards it. There is a guiding body, a global public-private partnership, all working towards one clearly defined goal of eradicating polio. Next slide, please. So what can we learn from those successful initiatives for hand hygiene for all? It must definitely go beyond one initiative. It must go beyond one slogan. We can learn from those initiatives that happened. We can look at the lessons learned. We can take what we already successfully gained, sometimes in hard lessons learned, and kind of try to translate them for the Hand Hygiene for All initiative. So again, we come to the importance of political leadership woven through all levels. We need clearly defined goals and outcomes, which ideally also kind of equal speaking points for politicians, going back to the elevator pitch, and how it's best if you can easily explain something that needs to be done, to increase understanding of everybody that should be involved. Then we need to look into global, national, subnational, sometimes regional goals, and an integrated and convergent implementation. The complexity levels are very high. We know our barriers, but we don't necessarily know our solutions. Very similar to, for example, the Swachh Bharat mission, where it wasn't 100% clear how to get to openification-free India. And we need to get the prioritization right currently with very deadly COVID-19 waves going on in a variety of areas worldwide. We need to make sure that while we're working towards hand hygiene for all, we're not forgetting the immediate priorities. So the reality on country office or country level currently is that many are struggling on, for example, where to go with their national roadmaps that are accompanying the hand hygiene for all activities, due to the lack of a clear goal and the definition. So the question is, how do we plan? And most important, how do we operationalize hand hygiene for all? And how do we know if and when we're there? So handing over to Ron, or back over to Ron, who will remind us of a couple of key takeaways of the first 4 sessions and will explain the breakout rooms to us. Thank you.
So we will be going into the breakout sessions now. And again, wanted to remind you of some of the things we've covered in the previous think tank sessions the past couple of weeks. Next slide. So just looking back, these are some of the key takeaways we had from the previous 4 sessions. And of course, today, in the previous sessions, we had much more open questions. But today we in some ways have much more specific questions. And next slide. So the questions that we're asking for the breakout groups to address first is, what is universal hand hygiene? What does that look like? What are we aiming for? And then the next question is, how do we know we've reached universal hand hygiene? And so that means we have to come up with hand hygiene indicators at the global and country levels to say, this is what it means for us to reach universal hand hygiene. So these are more specific questions, but of course, these are big questions as well. And next slide. And the way we'll be doing this is the 2-4-8 method. You'll be going into groups of 2, and then you'll be flown in magically into groups of 4, and then you'll be combined into groups of 8. And so at each step along the way, we want you to answer these questions. And then when you get to the other group, compare your answers, consolidate them, cut off the things that you don't think are as important, add new things that you think should be included, and then moving on to the group of 8 to do that again with these 2 groups of 4 to consolidate, to refine, to really develop the answers to these questions. A couple of comments here. For these groups, you'll be taken into these groups automatically. You don't have to click any buttons. You don't have to do anything. So when you get to the end, it gives you the countdown, and you see the button that says leave breakout room. Don't click that, or you'll come back into plenary. So just stay there, and Erin will make sure that you all get into the right groups. And so, and for you that have gone through this process before, you know how it works. And so you can help to explain it to your partners who've not gone through this 2-4-8 process. And we do have the tools for you to use. We have the Excel spreadsheet. And so for the spreadsheet, just go to a line and put the names of your pairs there. And then you'll move on from there. And then at the end, when you get to the group of 8, That's where we want you to consolidate your answers, get them together, and then put them onto a slide that will be presented back to plenary. And please identify someone who will present the results from your group of 8 back to plenary. You'll have about 20 minutes for each. You'll have about 20 minutes when you're working as a pair, 20 minutes working as 4, and 20 minutes working as a group of 8. So we look forward to great results here. And next slide. And again, here's the questions to answer. What is universal hand hygiene? And then how do we know we've reached universal hand hygiene? And so that means coming up with those indicators, both at the global level and at the country level. And so, but we really want to focus on the country level. You know, global level, we feel like a lot of that comes from the country level indicators. But also, you know, we just see this immediate need for the country level as these different countries go through the process of developing their hand hygiene roadmaps. We have an opportunity to provide guidance to them. So again, go into your groups of pair, answer the question, what is universal hand hygiene? And then what are the indicators for that at the global level, but especially at the country level? Okay, if there's any urgent questions, please just sound out now, take yourself off mute and ask. And if there's not, you'll be flown into your pairs and you can start work. Hey guys, how was it?
I'm back. Welcome back, everybody. Ron, do you know how many people exactly we were to start with? I think we have, yep, we have everybody back, I guess. Wonderful.
Yeah, we had 22 people in the breakout groups.
Oh, we're good. Welcome back, everybody. How was it? How was the process? How did you enjoy the discussions? I heard that there is one group that's now called the best group. I can vouch for them to tell the best jokes, that's for sure. I listened into lots of stories about ick factors. Lots of big discussions about big ideas. Does anybody want to share how you liked the process in itself? Just giving the note takers a couple more minutes to finish the slides so that we can start proper debriefing.
We had a little bit of a mismatch between the questions that we were supposed to discuss and then what we were to put out, right? Because we were discussing what is the universal hand hygiene, and to me that was more of a definition that didn't necessarily result in an indicator. But then when I went to the final slide, it was like a list of global indicators and a list of country-specific indicators. So that threw me a little bit because I thought we were talking about more qualitative definitions versus indicators for the first question.
Did anybody else have the same feeling? Then I can explain what was our thinking behind it yesterday. No?
I thought, and we had this discussed in the preparation for this, there's a tendency to like stick with the first of the breakout group questions and not really, excuse me, move to the second. Excuse me. And so I think like including our group, we got a little bit stuck with the first one, and this sort of forced us then to move the discussion along. But in general, I'm always amazed with these 2, 4, 8 groups, how much the discussion is evolving and how many different aspects of the problem we're discussing throughout sort of this process. So yeah, I really enjoyed sort of having, like, really seeing this discussion like like being very, very complex and really bringing a lot of arguments on the table.
Yeah. No, I think that was our kind of thinking behind it as well, was to first think through in a larger concept, what is universal hand hygiene? What does it mean? And then once we've defined that, the question would be, how do we know that we've reached it? So this is kind of where the indicators come in on a global level, on a country level. But interesting that you saw a mix match there. Let's see what the results of the group discussions were. Erin, if you can start showing us the slides, the modest group. Wonderful. Who of the modest group is going to present?
Wait, since when are we the modest group? First of all.
Well, the other group was a bit boastful because they were the best group. So I just thought I'd counter that.
Modest
Okay.
but mighty.
Yes, modest and mighty.
Okay. I can do that. If I asked the question, there was silence. So unless someone wants to like jump in now, 3, 2, 1. Okay, I'm gonna present this, and then everybody like from my group, please add to it. So we first we sort of put it on the table. SDG goal. Every household, every institution has a hand washing facility that's easily accessible. And so for a lot of our discussion sort of evolved around the point of sort of taking the example of the Swachh Bharat movement into consideration, where the Indian government had been throwing money at hardware for quite some time, which with little success. So should our goal be everybody has the opportunity to wash their hands when they want to, or should we do we need to turn this completely on its head and say we want people to feel an urge to wash their hands, either through social norms and social pressures, or through through habits that are built on from early childhood, in just sort of an internalized norm and disgust when we don't wash our hands in certain moments. And so we put together sort of I guess the bottom part of the slide is sort of a list, maybe a checklist for what could a certification for a safe hands community look like. So the first 2 or 3 are less at household level or individual level, but more at a community level and institutional level. So have regulations for adequate infrastructure in institutions. We're discussing a little bit housing regulations as well, so to not approve from the housing department the construction of a house unless there's a hand washing station there. And then long-term budgets for water and sanitation to make hand washing continuously accessible. It's a little bit sort of those are more focused on public places, public institutions, because it's simpler to regulate there. But maybe that's also consistent with some of the earlier discussions in the think tank about making hand hygiene a public behavior and really leading the public spaces leading the way. Then we talked about supplies being available at the market, not just hand washing stations being in place, but soap replacements, handymen that fix my hand washing stations, etc. That can be sort of as a checklist. We could go into a community and say are these things available when needed. Of course, that would be sort of a data collection and snapshot. Then when it comes to behaviors, we discussed in I think the first session how the list of key moments grew really longer in the COVID-19 response on when to wash your hands. And we try to break it down to something really simple that can be either observable or self-reported after using the toilet, before eating and preparing food, and when coming home, sort of to simplify things. And this is out for discussion. It's not sort of our final wisdom. And then sort of the last thing that we talked quite a long time about is how do we sort of create but also measure those social norms, like when Nicole mentioned the ick factor, like how do we get people to feel like, ugh, I want to wash my hands when like leaving the toilet or before eating, or like feeling uncomfortable if you don't have an opportunity to wash your hands. So yeah, that's a lot of the different the different areas of tension with like the infrastructure being there, but really needing to be led by the demand and social norms. Sorry if we don't have the final answer for that measurement, but that sort of was in our, yeah, that's sort of a summary of our discussion. I don't know if this is if anyone of my group would like to contribute to this, or if you have any further questions on specifying any of this.
Thank you very much, Sunita. Anyone of the group who would like to add something? Anyone from the other group who has some questions that came up about this? So I think calling you the modest group might have been a mistake, because no questions means you found the perfect answer, I guess. Erin, can we can we move to the next slide, please? Thank you very much. And of the best team, who will report back to the group?
I'm happy to report back to the group unless any of my colleagues likes to step into that role.
Why don't you go for it?
All right. Thanks. So with the endorsement of the team, with the endorsement of one, I'll take that. So we took somewhat of a different tact on the universal hand hygiene definition, which was really trying to put it around setting a vision of universal hand hygiene. So, you know, not somewhat clumsily worded given the time frame, but really around imagine a world where everyone is washing their hands. And in this world, we're seeing reduced hand-transmitted diseases and infections, improved productivity, mitigation of disease outbreaks, and you know, we can go on with that long list of the impacts of improved hand hygiene. And then we really kind of pitched that or structuring that as a way of trying to get more high-level buy-in in the spirit of the Swachh Bharat mission, and trying to put forth an idea where we could get some of that support and really, you know, try to move the needle on hand hygiene. And then, you know, shifting to the global indicators of this, it's really, in our mind, the number of countries that are implementing national hand hygiene programs with the hand hygiene policies and commitments and roadmaps in place. Another one that we thought was interesting was the integration of hand hygiene into other sectors, into, you know, making sure with the World Bank lending programs that there's hand hygiene in the schools program, with emergency responses, they're making sure there's hand hygiene. In tourism, is there hand hygiene? Given the broad application and the underpinning or the application of hand hygiene across sectors, we think this could be a real opportunity to scale up and really embed the practice across a number of sectors and make it really lending to that idea of a universal practice. Then looking to the list of country-specific indicators, we've really seen that there are, you know, there's somewhat established hardware and behavioral indicators, and really, you know, would continue to pursue those as the measurements of if a country is achieving universal hand hygiene facilities that are fully stocked in all the key settings and available at all the key times. I think we've kind of come to that agreement. But then I think some of the challenges are, and that would really vary country to country, around the process indicators. So getting in place a hand hygiene policy and budget national M&E structures, making sure the supply chains are strong, working towards societal changes in behaviors, establishing regulations, and then related to the second point and the global indicator of the integration of hand hygiene into other policies as well. So let me pause there and pass it to the rest of the BEST team to add their inputs.
Thank you very much, Nat. Who is the rest of the BEST? Anyone who wants to jump in? Okay, Nat, I think you win jointly with the Modest team the title of Best Presenter and Best Summarizer.
Is there a tiebreaker, or is that we just go with that?
The prize is a piece of soap. So
Shoot off, shoot off.
Maybe you're the best, but we're the most modest. So I don't know
It's an
which
honor
title
just
you
to be included.
wonderful. I think based on those two kind of feedback presentations, what would be good is, Erin, I don't know, would you mind taking the presentation down? I think it's always a bit nicer if you can see each other, and thereby turning my camera back on for a discussion. I can't believe that we have 23 hand hygiene experts and no one has a comment on any of the two report backs. Fair warning, I'm going to start singing hand washing songs if I don't hear anything.
I can make a comment, and you know,
Hitty.
this is maybe rather a question actually for this team. When I think about universal hand hygiene, I think there is an element and a challenge of how do you standardize hand hygiene across the globe, right? I think I shared with our group, with the Modest team, like one of the challenges I had during the COVID period, which was like, how do I standardize the practice even among my 3 children that range from 10 to 20 years old? I mean, you know, what helped me was basically CDC guidelines, which I was like, hey, now we have an authority that you guys cannot challenge, and it's telling us this is the process. So just rub, you know, passing your hand under the faucet is not I washed my hand. So you could go and bring in a scale, and you really want to implement a habit that is not even embedded in certain cultures, or, you know, has, you know, got a lot of limitations for it. I think that element of how do you standardize it and how then you really implement it becomes the most challenging piece. It's not only about availability of facilities. So I'm just putting that out there, and I'd love to hear thoughts from this group.
Sean, do you want to go?
I was just going to almost say the slightly annoying question of, you know, I think there was a lot of richness in those discussions, and we can definitely work towards some of those big aims, but also what are the kind of micro actions that we can all take within our individual organizations or within our individual spheres of influence that could be, you know, what do we do from tomorrow based on this discussion? That would be interesting to hear from people.
Tanita, do you want to elaborate on your comment in the chat?
Yeah, it struck me a little bit, sort of how we're still struggling to put like concrete indicators towards what sort of, like we've been talking about hand hygiene policies and sort of the enabling environment and budgets, but and like when we say we sort of like they need to be in place and we need to like do social norms, but like yeah, I think we're sort of like it was a rich discussion, but still like there was even like both the modest and the best, we didn't come up with like the specific thing, the one measurable indicator, and I'm wondering sort of, I guess like our best bet in terms of specific indicators was the infrastructure bit, but we sort of realized that sort of the whole narrative of what leads what and what comes after what, we might need to rethink when we talk about indicators. So I was just sort of, I think it just sort of shows how relevant this question is that we've posed, or that you have posed, you have brought to the group, and that there needs to be a lot more thinking going on, and maybe a lot more like conversation tapping into like the Swachh Bharat or the Clean Green Pakistan, and like having some of those conversations of people that were closely involved in those, to really understand what made them successful as a campaign. So I'll let others come in, but just sort of that was my brief reflection on the modest and the best groups.
Thank you. Joanna, do you want to follow up?
Muted.
I can do, thanks. But I see Shan also has her hand up. I don't know if it's a legacy hand or... Are you okay for me to go, Shan?
Sorry, I hadn't taken it down. My bad.
Yeah, cool, thanks. Yeah, I just wanted to appreciate as well the question, and to say we definitely haven't cracked it in this round of discussions. Hopefully we'll have more opportunities to discuss further. But also I think maybe to be a bit controversial, and you know, I'm not saying that I'm fully wedded to this idea, but I think in the absence of a really clear target that we can all do, a rallying cry in Janita's words, that we can all kind of put our name to, I do think there's a very powerful argument to be made in the wake or in the midst of COVID-19 to say, you know, the main call to action for people off the back, for individuals off the back of COVID-19 in terms of risk management was 3, you know, social distancing, masks and hand hygiene, and 40% of the population just didn't have anywhere to wash their hands. And I think that's just a really powerful point to make. So even if it's incomplete, even if it's inadequate, and even if it might push the behavioral elements a bit further from view than we want, it's still a really important point that infrastructure is valuable. And so if we're looking for a rallying cry, yes, we already have the JMP target. Maybe we need to make more of that, and continue these conversations and continue to try to reflect things in a more comprehensive way. But certainly for open defecation, I think the benefit of the open defecation target, which as we all know was just a very bare minimum, and similarly having a hand washing station would be the very bare minimum. I'm not saying it's the gold standard of an indicator. I think the difference is with open defecation free, it's with open defecation, it's a very public behavior. And so you can monitor it in that way. With hand hygiene, it's a very private behavior. So there's always going to be that challenge of finding a target or a way of monitoring it that works. And I just think maybe we shouldn't miss what's staring us in the face whilst looking for the perfect indicator when 40% of the world's population don't have somewhere to wash their hands.
Get the low-hanging fruits done first, or start with them at least.
That was a much quicker way of saying what I just said. Thanks, Nicole.
That is my task for the day. Please go ahead.
Thank you. So, I mean, I do agree what both Janita and Zoe have said. In terms of, I think, monitoring the outcome, it is easy if we are monitoring the facilities. But we know we have been there into the sector for quite long. And despite having the facility, people are still not doing it, right? If we're talking about the desire that we want to create, the standard that we want to see, within just 1 year, if you go in every corner of the shop now, what you are looking for first? You're looking for the hygiene corner. Do they have the sanitizer, right? That mindset, how are we going to curate? How are we going to standardize something that sticks in people's mind so that everywhere we go, irrespective of schools, healthcare settings, or in public locations, or in house, we desire for that product, right? Curating that inspirational desire from the behavior sense is quite, I mean, that's the desire that we want to achieve, right? But it's very difficult to measure. As Joe mentioned, it's private sometimes, it's people don't want to showcase, it's not a public behavior that everyone would like to show. It's a very difficult measure from the measurement point of view. But I think the way we can leverage there is standardization, right? If we standardize some of the elements, every household having universally, every household has having facilities, but then there are some standards to stick with it, right? For the institutional, maybe an inclusive, accessible facilities at household level, having universally having these facilities, but then standardizing it, people practicing it, right? So that the people look it. My other comments were on your presentation, Nicole. You mentioned about the Clean Green Pakistan. You mentioned about the Swachh Bharat mission. These two missions where water is also involved in Clean Green in Pakistan. My way of looking this is there are elements of the leadership, right? These leaders came on board and they actually inspired and created that momentum. It was a luck in last, I mean, we have been in the sector for last 40 years. There was a luck in 1 year that Modi came in the power, and then the Imran Khan has came in power and drive that movement. So my way of looking this, do we wait for a luck to bring these leaders, or we create a luck? As a sector actors, I think we should start curating that luck. How we do this? Maybe exposing, maybe now the Ethiopia is looking for SEDU campaign. They went to India, now they want to replicate the similar model in Ethiopia, for example, right? So kind of curating that momentum is not only political commitment, but also how as an actor, we curate that momentum is quite key. The other point that I want to make is we have been there into the sector for the last 40 years on sanitation. We know that people after defecation need to wash their hands, right? But we have promoted open defecation is a toilet business. Everyone building the toilet. Was there a discussions in the beginning that despite knowing the fact that people need to wash their hands, the hand hygiene facilities and toilet never been a kind of the twins in many ODF initiatives, right? I think I think that the two way I really want to put this forward. Political commitments and their effective implementation is equally important to drive that sense at large scale. And I mean, let's not wait for a luck for politicians to come. Let's not wait for a pandemic to come to think about the scale. If we also frame some of the indicators around that, would be great to reach the milestone. Thank you.
Fantastic. Thank you very much. Robert, do you want to do us the honor of some final comments? Because we're getting very close to having to close the session.
Sure. Well, I'm sorry, this will be the ending comment then. You know,
no pressure at all.
All right. Well, I mean, I think it's important that we remember when we're talking about these indicators that we look at infrastructure not just because we're interested in infrastructure, or because it's there, but because we know people who have a hand washing station are more likely to wash their hands with soap compared to people who don't. I mean, like a dedicated location where both soap and water. I think we've got to remember that these infrastructure indicators are telling us something about the behavior, not just the capability of doing it, but also about kind of the probability that it's actually being kind of done. So it's not, you know, let's not throw, I guess I'm agreeing with Joe that let's not forget, we have a global indicator. We tend to kind of over-infrastructuralize that and forget that this actually means something from a behavioral perspective as well. So, hand down. And thank you for coming to the hand wash.
Let's give Ron the opportunity to close officially. No, but I think that was actually quite an interesting comment to close with. Thank you very much for this. As we can see that the whole conversation is very much still, I agree with you, Janita. I don't think we've found the solution today, but I think it was a very interesting conversation to have. And I think we need to continue having it. going for the low-hanging fruits shouldn't be the result of a discussion. It should have been, you know, it is what we're already doing since the last, not just the last year. We always kind of seem to pretend that we only started hand washing now, but it's been done over the past decades. And this linkage between, I think that the point that you made, the linkage between having the infrastructure available and therefore having even the opportunity to practice the behavior is the bare minimum start that we can do. And therefore the arguments that were made to look first into infrastructure, I think that has a certain logic behind it that could be pursued, apart from allowing us to monitor something relatively simple, getting into the momentum. We all started counting toilets before we started counting open defecation-free communities. So, you know, you got to start somewhere. Thank you very much for the discussion. I'm going to hand over back to Ron for the next steps. Thank you.
Well, thank you, Nicole, and thank you, everybody. Such great, rich discussion today, and thank you for everything that you've done to make this think tank a great success as we've developed outputs to share, because that's really a big part of the reason for the think tank. Certainly, part of it is so that all of you can come together and have this networking time and this time to think through these issues together. But then another part of the think tank is the next steps and sharing this outside with everyone who we want to be addressing hand hygiene. And so we will be developing a report from the think tank, all of the outputs that we've developed over the past 5 days. And then also we will have a webinar to present those findings. In addition to that, then we're still working through how we'll be using this framework for regional events, for regional think tank meetings, to take one or more of these topics and to address that at a much smaller context. So we're looking forward to being able to facilitate that. And also we'll be presenting the findings through key events and conferences beyond that. So that's the next steps. And of course, many of you will be involved with that. I mean, the work of the Global Handwashing Partnership is always through our partners. And so that's the next steps for all of that. And again, I just wanted to say thank you. There's been such great discussions during these 5 different days on these 5 different topics. You know, I think we have moved the thinking forward some as a group in a way that, you know, we would not be able to do that as individual institutions. But we're still left with some big questions, because these are big questions that perhaps have difficult or impossible answers. But through all of that, we have outputs from the think tank, which will be valuable for governments, for NGOs, for implementers, to be able to increase the practice of hand washing and good hand hygiene. We will be sending out a survey, so please complete that survey and send it back to us. We want to learn from the processes of this think tank and also have guidance on what we should be looking at for our next think tank and think tanks. So again, a very large thank you, and I would be remiss not to say thank you to my colleague, Erin Palomares, who has kept us all on track here for these 5 days. And I would just offer applause to her and Astrid and Orjeb and really everybody, all the facilitators for the groups. You've all done just such a great job. So thank you very much. Okay, well, thank you, everyone. Look forward to to our next steps here, and we'll be talking with you. Thank you.